If you're over 60, this one everyday habit could be silently pushing you closer to a stroke while you sleep. No chest pain, no warning signs, you go to bed feeling fine. And by morning, your speech is slurred, your balance is gone, or you can't move one side of your body. As a brain doctor, I've seen this happen far too often, and not because of smoking, sugar, or lack of exercise, but because of something far more surprising. Vegetables. Yes, really, vegetables. Every day, millions of seniors load their plates with greens and veggies, believing they're doing the right thing. And while many vegetables do support brain and heart health, a few, especially when eaten the wrong way or in the wrong combinations, can quietly create the perfect storm for blood pressure spikes, artery constriction, and even stroke-inducing blood clots. In this video, I'll walk you through 5 common vegetables you probably have in your fridge right now that could be putting your brain at risk without you knowing. So if you care about your independence, your memory, and staying out of the hospital, watch this all the way through. What you learn could save your life or the life of someone you love. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Spinach, the healthy green that could secretly trigger a stroke in your sleep. If you're over 60, chances are someone once told you that eat your greens, especially spinach, it's good for you. But what if I told you that this so-called superfood could quietly push your brain toward a life-changing stroke, and you wouldn't even feel it coming? As a neurologist, I've seen this more than once, where a well-meaning habit becomes the trigger for a silent disaster. The danger with spinach isn't in a single serving. It's in the daily repetition, the smoothies, the salads, the green powders, especially when eaten raw and in large amounts. Spinach is packed with oxalates, natural compounds that bind with calcium in your bloodstream. In younger, healthy bodies, the kidneys can usually flush it out. But in older adults, especially those with reduced kidney function or mild dehydration, oxalate levels can quietly climb. When oxalate binds with calcium in your blood, it can lead to calcium oxalate crystals forming in your arteries. Over time, these crystals contribute to arterial stiffening and narrowing, laying the foundation for blood clots. And yes, it forms blood clots that can go straight to your brain. Let me tell you about Mr. Howard Ellis, a 77-year-old retired dentist from Pennsylvania. He was sharp, active, and proud of his clean eating habits. Every night for 2 years, he made the same green smoothie: raw spinach, banana, almond milk. I thought I was feeding my brain, he told me. But one morning, his wife found him slumped over the kitchen table, unable to speak, his right arm limp. Stroke. When we ran his labs, his calcium levels were abnormal, his arteries were stiff, and his kidney filtration rate had quietly dropped below normal. The culprit wasn't sugar, meat, or smoking. It was overconsumption of raw spinach, combined with age-related kidney decline and chronic mild dehydration, a healthy habit that turned deadly. And here's the terrifying part. There were no warning signs, no chest pain, no dizziness, just a good night's sleep, and a silent storm building in his bloodstream. Howard survived, but now struggles with speech and mobility. He told me through tears, "Doc, I thought I was doing everything right." This is why I'm raising the alarm. Not everything labeled healthy is safe for every age, especially when combined with medications like blood thinners, diuretics, or calcium supplements. Spinach can tip your blood chemistry just enough to make you vulnerable while you sleep. So if spinach is part of your nightly routine, or if you're blending it raw without medical supervision, please stop and reassess. It's not about giving up healthy food. It's about eating the right foods, the right way, for your stage of life. And if you think spinach was surprising, wait until you learn what a simple cucumber might be doing to your blood pressure while you sleep. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Cucumber. The safe snack that could spike your blood pressure and starve your brain while you sleep. It sounds harmless, doesn't it? A few slices of cucumber before bed. Crunchy, hydrating, low in calories. For decades, cucumbers have been labeled as one of the safest foods to eat, especially for older adults trying to lose weight or manage their blood sugar. But what if I told you that this cool, crisp vegetable could quietly become a trigger for dangerous overnight blood pressure swings and, in some cases, stroke-inducing blood clots? As a brain doctor, I've seen firsthand how small, innocent habits create hidden risks, especially in seniors. The danger with cucumbers is not in their nutrients, but in when and how they're consumed, and what they do to your body's hydration, electrolytes, and blood pressure regulation while you sleep. Cucumbers are a natural diuretic. That means they help your body get rid of water, especially sodium, by increasing urine output. During the day, that might not be a problem, but if eaten in the evening or before bed, cucumbers can lead to overnight fluid loss, especially in older adults whose kidneys no longer regulate fluids as efficiently. Here's why that matters. As we age, our arteries become less elastic, our nervous system slows down, and our brain becomes more sensitive to shifts in blood pressure. Combine this with age-related dehydration, medications like diuretics or beta blockers, and suddenly your body can't keep up. Blood pressure drops too low while you sleep, then rebounds rapidly in the early morning hours, creating the perfect storm for clot formation or blood vessel rupture in the brain. One of my patients, Mrs. Dolores Green, age 81, a retired school teacher from Ohio, came to me after experiencing several episodes of early morning dizziness and blurred vision. She told me she had been eating cucumber slices every night as a light, healthy snack and drinking lemon water to stay alkaline. But her blood tests showed electrolyte imbalance, and her overnight blood pressure readings were dangerously low, followed by sharp spikes just before dawn. Then came the mini stroke, slurred speech, facial droop, confusion, thankfully temporary, but terrifying nonetheless. When we pieced everything together, the nightly cucumbers combined with her blood pressure meds had silently triggered an unstable circulatory pattern. A simple, well-meaning snack had weakened her brain's blood supply, and it nearly cost her the ability to speak. This is the kind of danger that most people never hear about. No one tells you that something as harmless as cucumber could tilt the balance of your blood chemistry, especially at night when the brain is at its most vulnerable. You don't feel it. You just wake up dizzy one day, or worse, you don't wake up the same at all. So the next time you reach for cucumbers before bed, remember this: at our age, hydration is delicate. Electrolyte shifts are dangerous, and blood pressure is a fragile thread between safety and stroke. And speaking of silent threats, what if I told you that one of the most trusted vegetables in America might be quietly interfering with your thyroid and brain circulation at the same time? Let's talk about broccoli. 3. Broccoli, the brain food that could quietly disrupt your thyroid and starve your brain of oxygen. You've heard it your whole life. Eat your broccoli. It's good for your brain and heart. And it's true. Broccoli is rich in antioxidants, fiber, and nutrients that can support health at any age. But what most older adults are never told is that, in certain cases, this well-meaning vegetable can quietly interfere with your thyroid function, weaken brain blood flow, and even contribute to the formation of blood clots that raise your risk of stroke, especially if you're already vulnerable. Here's the truth. Broccoli belongs to the cruciferous family of vegetables, which also includes cabbage, kale, and Brussels sprouts. While nutritious, these vegetables contain compounds called goitrogens, which can interfere with thyroid hormone production, particularly when eaten raw and in high amounts. For a younger person, the body often compensates, but for adults over 60, thyroid function naturally slows down, and any added strain, like daily raw broccoli, can tip you into dangerous territory. When thyroid hormones drop, your metabolism slows, your heart rate becomes unstable, and blood pressure can swing unpredictably, creating the ideal environment for poor circulation, sluggish blood flow, and yes, the formation of clots that can travel to your brain. I treated Mr. Arthur Blake, 79, a retired engineer from Minnesota who had switched to a strict plant-based diet to stay sharp in his older years. He was eating broccoli, steamed, raw, and in smoothies, sometimes twice a day. At first, he felt good, but within months, he began experiencing intense fatigue, brain fog, and occasional numbness in his left hand. His family thought it was just aging, but one morning he collapsed while walking his dog. It was a mild ischemic stroke caused by a small clot that lodged in a cerebral artery. His blood work revealed subclinical hypothyroidism, low heart rate, and thickened blood. The overconsumption of raw cruciferous vegetables, particularly broccoli, had suppressed his thyroid and slowed his circulation to the point where his brain was starved of oxygen. He survived, but now lives with partial weakness in his left arm and vision changes. What scares me the most is how easy it was to miss. There were no red flags, no chest pain, no high cholesterol, just a smart man trying to eat better, without realizing his healthy routine was quietly altering his blood chemistry and creating the conditions for a stroke. So let me be clear. Broccoli can be healthy, but not in excess, and not raw every day if you're over 60, especially if you have any history of thyroid imbalance, low blood pressure, or are on medications that affect circulation. Your aging brain needs stability, not surprises. And if you thought broccoli could be risky, wait until you hear how one common kitchen ingredient, celebrated for heart health, could thin your blood so much that a tiny vessel in your brain might burst. Let's talk about garlic. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. Garlic, the natural cure that could thin your blood to the point of a brain bleed. Most older adults believe garlic is one of the healthiest things they can eat. They're told it's natural, it lowers cholesterol, improves circulation, and even fights infections. And yes, garlic can be powerful, but that power cuts both ways. For seniors, especially those already taking blood pressure or heart medications, garlic can quietly become too powerful, thinning your blood to the point where a single fragile vessel in your brain can rupture without warning, without pain, while you sleep. Here's the real danger. Garlic contains allicin, a compound known to reduce platelet aggregation, essentially acting as a natural blood thinner. That might sound like a good thing, especially if you're worried about clots. But when combined with aspirin, Plavix, warfarin, or other prescribed anticoagulants, garlic doesn't just support healthy blood flow, it can amplify the effects of medication, sometimes to the point where your blood becomes too thin to clot when it needs to. This isn't just theory. One of my patients, Mrs. Joan Whitmore, 84, a retired piano teacher from Oregon, came to me after an episode that changed her life. She had been taking warfarin for atrial fibrillation, carefully monitored by her doctor. But she'd also started eating 2 raw garlic cloves every night, something she read in a health magazine that reversed aging. At first, she felt energized, but then came the headaches, the confusion, the nausea. One evening, she collapsed while brushing her hair. A brain scan revealed a hemorrhagic stroke, bleeding inside the brain. No trauma, no fall, just one small blood vessel that couldn't seal itself because her blood was too thin. Her INR, a measure of how thin the blood is, had spiked dangerously high, not because of her medication, but because the raw garlic had amplified its effects beyond control. Joan survived, but she now requires a walker, daily speech therapy, and full time care. What's most tragic? She thought she was doing everything right. She told me, I never thought garlic could hurt me. It's food, not a drug. And that's the problem. When you're over 60, food can become medicine or poison, depending on what else your body is going through. Garlic isn't inherently bad, but at this age, it must be used with caution and under supervision, especially if you're on any medications that affect your blood or heart rhythm. A little bit of raw garlic here and there might be fine. But daily high doses, especially on top of prescribed drugs, that's not natural. It's dangerous. And here's the cruel irony. While garlic can make your blood too thin to clot, another common vegetable, praised for its antioxidants, can have the opposite effect. It can raise your blood pressure, constrict your vessels, and quietly set the stage for a clot to block the blood to your brain. Let's talk about eggplant. 5. Eggplant, the forgotten vegetable that could constrict your arteries and trigger a stroke without warning. Eggplant seems harmless, even healthy. It's a staple in many heart-friendly recipes, packed with fiber, antioxidants, and low in calories. It's often praised as a brain food thanks to a compound called nasunin, known to protect brain cells from oxidative damage. But what most seniors don't realize is that eggplant also contains solanine, a naturally occurring plant toxin that, in the aging body, can quietly set off a dangerous chain reaction inside your circulatory system. Solanine is part of the nightshade family, and in small doses, most healthy adults can tolerate it. But for people over 60, especially those with weakened circulation, chronic inflammation, or underlying neurological issues, solanine can cause vasoconstriction, which means your blood vessels narrow. When that happens in the brain, blood flow drops. And when blood flow drops, the risk of clot formation skyrockets, especially at night when blood pressure tends to fluctuate. I remember one patient vividly, Mr. Franklin Monroe, age 82, a retired railroad mechanic from Kentucky. He was active, alert, and proud of cooking his own meals. One of his favorite dishes was eggplant parmesan. He made it twice a week. But over time, he began having strange symptoms: headaches, cold hands, and a heaviness in his chest when walking upstairs. His primary care physician thought it was just aging. But one morning, Franklin collapsed in his driveway. He had suffered an ischemic stroke. A clot had blocked blood flow to the left side of his brain. During our review, we found no cholesterol issues, no smoking history, but his labs showed signs of vascular inflammation and a buildup of compounds consistent with solanine sensitivity. His diet, high in eggplant and other nightshades, had been quietly narrowing his arteries. It formed blood clots in the shadows, undetected, until one reached his brain. Franklin now uses a wheelchair, and while he's mentally sharp, he told me, "Doc, I thought I was eating smart. I didn't know I was slowly cutting off my own blood supply." And that's the lesson. It's not just about what's healthy in general. It's about what's healthy for you at your age with your history. Eggplant isn't poison, but in large amounts, And in older adults with circulation issues, it's a risk that builds slowly, then strikes fast. So if these 5 healthy vegetables can be dangerous, especially for the aging brain, what should you be eating to protect your memory, your clarity, and your independence? Let's talk about the foods that truly nourish the older brain, naturally, safely, and effectively. 6. So what should you eat? Real foods that truly protect the aging brain. After hearing how 5 common vegetables can quietly raise your stroke risk, many seniors are left asking, what's even safe to eat anymore? It's a fair question, and one that deserves a thoughtful, science-backed answer. Because here's the truth most people overlook. Your brain doesn't need trendy superfoods or supplements. It needs real, whole, natural foods in the right balance, eaten at the right time for your age and body. I once treated Mrs. Margaret Wilson, 73, a retired school principal from Arizona. She walked into my clinic with a drawer full of supplements and a heart full of frustration. I'm trying everything, she told me. Vitamin D for bones, E for circulation, a brain-boosting smoothie every night, loaded with spinach, garlic, and eggplant. But despite her efforts, she felt dizzy every morning. Her memory was slipping. Her blood pressure spiked overnight. What she didn't realize was that her healthy routine, packed with foods and pills that seemed good, was creating subtle chemical imbalances in her aging body. It was thinning her blood too much in some places, thickening it in others. It was dehydrating her brain, spiking her blood sugar, and altering how her medications worked. The result? A dangerous setup for blood clots and microstrokes, the kind that slowly steal your balance, clarity, and independence. So we did something radical. We cleared the clutter. We replaced the pills and powders with simple meals built from brain-friendly foods, a boiled egg and avocado for clean protein and healthy fat, a slice of whole grain toast for slow, stable energy, a handful of blueberries rich in polyphenols that reduce brain inflammation, a glass of room temperature water to gently rehydrate the brain after sleep. Sometimes we'd add walnuts or a small piece of salmon for omega-3s. That was it. Within just a few weeks, Margaret's dizziness faded. Her memory sharpened. Her blood pressure returned to a safer range. I feel like I'm finally feeding my brain, she told me. And she was. Because real food doesn't just fill you, it heals you. It doesn't create spikes, crashes, or silent damage. It supports every vessel, every neuron, every breath. But here's the warning. Even these healing foods must be eaten in the right way, because timing, hydration, and medication interactions still matter. What works for one person may backfire for another if the body is inflamed, dehydrated, or vulnerable. So now that you know what to eat, there's one last truth to face, perhaps the most important of all. It's not the food or the pill that decides your future. It's your awareness of it. Let's talk about that, because the final message could be the wake-up call that saves your brain and your independence. Awareness is the most powerful medicine you have after 60. If you've made it this far, it means you care. Not just about living longer, but about living well. And that's why I want to leave you with the one message I've learned after decades of caring for the aging brain. It's not the food you eat, the pills you take, or the exercise you do that protects you the most. It's your awareness. At 60, 70, or 80, your body no longer responds the way it did at 30. Your liver processes slower. Your kidneys filter differently. Your brain is more sensitive to small shifts in hydration, blood pressure, and nutrients. That's not weakness, it's nature. But what becomes dangerous is when we ignore those changes and keep living like we're still young. Most strokes I've treated in seniors didn't happen because of obvious things like smoking or obesity. They happened because of silent habits. The healthy green smoothie overloaded with spinach, the bedtime cucumber, the garlic clove on blood thinners, the raw broccoli salad, the nightly eggplant dinner. All innocent, all well-meaning, but all capable of forming blood clots or triggering bleeds in the brain when the body's chemistry is already fragile. And most heartbreaking of all, these strokes stole independence. They stole speech, memory, mobility, not from people who were careless, but from people who were trying their best. So here is my deepest plea to you. Slow down. Ask questions. Read every label. Listen to your body when it whispers, not just when it screams. Talk to your doctor before adding anything, even a vitamin or a vegetable, to your routine, because sometimes the smallest choices have the biggest consequences. You are not powerless. You are wiser now than ever. And your awareness, your willingness to question and learn may be the single strongest medicine you have. Stay curious, stay cautious, stay alive. Your brain deserves it. You deserve it too. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.